Tuberculosis or TB, a disease affecting humanity since time immemorial, continues to be a major killer despite being preventable and curable. A major public health challenge in WHO Southeast Asia region, TB has significant socio-economic consequences for individuals, families, communities and beyond. With a huge disease burden, the region accounted for close to 5 million persons developing TB, which is 45% of global estimates for 2023. The region also accounted for nearly 600,000 deaths due to the disease, or more than half of all deaths due to TB globally in the same year. An estimated 30% to 80% of TB-affected families in the region face catastrophic costs due to the disease. Undernutrition is a leading social determinant of TB in the region, followed by smoking, alcohol use disorder, diabetes, and HIV infection. To address the scourge of TB, countries in the region have been rolling out numerous initiatives. As a result, between 2015 and 2023, the region witnessed a 6.7% reduction in TB incidence rate and an 11% reduction in the number of TB deaths. However, this decline has been slow and is not enough for us to reach the WHO End TB strategy milestones for 2025. Cognizant of the need for greater efforts against TB, in August 2023, countries of the region adopted Gandhinagar Declaration. A month later, the Political Declaration on TB at the United Nations High-Level Meeting in New York set global targets to reach at least 90% of people who develop TB, provide TB preventive treatment to at least 90% of the high-risk population, and ensure each and every person with TB has access to health and social benefits package. The declaration emphasized on people-centered approach and equitable access to quality health services. The political momentum against TB is unprecedented in the region and globally. We need to grasp the moment. We need to translate declarations and commitments into actions against TB for accelerated gains. For this, the highest levels of political leadership should prioritize and drive the national agenda on TB. A multi-sectoral coordination platform under the highest political levels should be established to ensure comprehensive and integrated TB control efforts. This is critical to address the multiple social determinants of TB and its impact beyond health. Legislative and policy frameworks based on the principles of equity are required to ensure access to high-standard care and services to all people with TB and protect their rights. Adopting a primary healthcare approach by integrating TB services into a broader health framework and ensuring comprehensive care for all is vital for improving access to TB services and achieve universal health coverage. Social protection measures, such as cash transfers and nutritional support, are essential for mitigating the social and economic impacts of TB. TB should be prioritized in national budgets, including through innovative financing mechanisms such as social impact bonds and public-private partnerships. Importantly, meaningful community engagement and empowerment should guide designing, implementation, and monitoring of TB programs. Countries in the region have been making efforts on these lines. Bangladesh hosted Global MAF-TB Forum in June 2024 to accelerate multi-sectoral action towards ending TB. India launched Adopt a Patient approach under the Pradhan Mantri TB Mukt Bharat Abhiyan for nutrition support. Indonesia's presidential decree on TB aims to implement a comprehensive strategy towards ending TB in the country. Maldives has rolled out TB-Free Atoll initiative. Myanmar was the only high TB burden country in the region to achieve 2020 milestones for decline in incidence before COVID-19 pandemic disrupted this progress. Nepal's TB-free initiative at Palika level aims at actively engaging subnational level systems in TB programs. Thailand has made significant efforts to improve coverage for TB services under its commitment to achieve universal health coverage. Timor-Leste initiated a partner's pledge to end TB led by the Prime Minister for a multi-sectoral approach. While a lot is being done, a lot more needs to be done, and with urgency. It is time to transform all our commitments and political declarations into actions. We need to accelerate efforts to achieve global TB goals. The time to act is now. Let's work together to end TB in the WHO Southeast Asia region.